on the affected side. And by giving a command to the patient, after holding the forearm in the mid-prone position to flex the elbow, you notice that there is no activity of the brachioradialis muscle in this patient. You can see again once more, and we do not find a similar standing out contraction of the brachioradialis muscle. Well, once you have this sort of a situation where there is no visible contraction of the muscle, the examination should not stop here, because we need to palpate the muscle belly before we declare that it is grade 0 in power. That means no muscle contraction is being felt in these cases. So the next maneuver would be you palpate the muscle belly with the pronated hand, forearm. You can palpate the pronated hand with the pronated hand, and this is how, when you ask the patient to initiate elbow flexion, you can follow up the contraction, trying to palpate whether there is any contraction in the muscle fibers. In this particular patient, there was none, so it was pronounced brachioradialis is grade 0 in power. Well, the next group of muscles which is to be tested is the wrist extensors. Again, first test it on the normal side, and this is how the patient actively dorsiflexes, and then you can apply resistance to grade the muscle as normal. Again, it is important to underscore at this stage that extensor carpi radialis longus and brevis are the radial extensors of the wrist, and the extensor carpi ulnaris happens to be the ulnar extension of the wrist. Well, it is not possible to individually test the extensor carpi radius longus and brevis, and in all those cases where the radial nerve is damaged distal to the elbow, there is a possibility that the extensor carpi radialis brevis may be saved, because it may be supplied by the posterior interosseous nerve, and in these cases there is a typical radial deviation of the wrist. Well, with this knowledge, we embark upon now testing the normal side of the affected side in this particular patient. And when you ask him to dorsiflex, he is not able to dorsiflex. But at the same time, you do get an impression that there is some activity in the dorsiflexors. Please note again, in the video, there is an initial impression that there is some dorsiflexion coming. Beware of this trick movement. Again, to revise or to re-emphasize, analysis of movement is not analysis of motor power. This must be remembered by the candidates. So what is happening in this particular patient is, if you look at the sequence of events which is occurring in this patient, watch the video again. This patient flexes the fingers first and then tries to extend the wrist, and here what he is doing is he is using the tenodesis effect of the long extensors or the extensor digitorum communis, which come into play the moment he flexes the fingers. So this trick movement should be detected or should be understood by the candidate, and it should not be construed as some amount of power is remaining. in the extensor carpi radialis longus and brevis. And once this sort of a situation occurs, you can cross-check. Well, once such a situation arises, you can follow the same dictum that you need to palpate the muscle belly in the proximal dorsal aspect of the forearm to declare the muscles as grade 0, just in case you cannot palpate any contraction in the extensors of the wrist. Well, going sequentially,